Hello, my name is Manuel Arreola. I have a PhD in medical physics from the University of Florida, and I have joined the RTU family recently, and I was asked to give you a brief summary of my professional career and experience. I completed my bachelor's degree majoring in physics, and actually doing my bachelor's thesis at the Metropolitan University in Mexico City. And my thesis was in lasers. I actually was part of the team that built some of the first lasers in Mexico back in those days. I'm not going to tell you how long ago. Then I had the opportunity to come to the United States and enroll at the State University of New York at Buffalo, where I did my master's work, again majoring in physics. And this time my research work was in nuclear magnetic resonance under the guidance of Dr. Jonathan Reichert. And I did some work on ESR and NMR at low temperatures. And that's where I learned a lot about low temperature issues and superconductivity and cryogens, and more than anything about NMR theory and experimental work. And as it turned out to be, among the group of friends that I had in Buffalo, which is a city that I enjoyed a lot, and to this day I'm a firm Buffalo Bills fan no matter what. And this particular friend is a radiologist in one of the major hospitals in Buffalo. And one time, as we were at some party or some barbecue, he asked me what is it that I was doing for my research. And when I told him that I was doing research in magnetic resonance, he said, "Oh, you should come talk to the physicist in our hospital." And of course my response was, "There's a physicist working in the hospital?" So to make the story short, he gave me a tour of the department, and I actually never had a chance to talk to the physicist there. But what this did was that it all of a sudden brought the field of medical physics in front of my eyes. And that goes along with the story that I frequently tell, that one of these evenings on a weekend that I was doing my research and my MR experiments, I was patiently waiting for the RF amplifier to sweep the range of frequencies that I needed to do for the sample that I was testing in particular. And just looking at the plotter, just drawing this flat line for half an hour, 40 minutes, until finally the resonance line would come up, and then it would go back flat again for another 10 or 20 minutes. Made me realize that that's not what I wanted to do professionally for the rest of my life, or personally, as a matter of fact. So these two things happened at about the same time, these two events. And I happened then to apply to the graduate medical physics program at the University of Florida. And there I then, within 6 months, I realized that medical physics was what I was looking for, because that would enable me to do work that would have a direct and true immediate benefit to other lives, in this case the life of the patients. As I was then faced with the choice of radiation therapy physics and diagnostic imaging physics, I was quickly drawn by imaging, because I could see that a huge explosion in technology was coming. There was, of course, a lot of research going, and the major modalities had already been developed and implemented clinically by then. Helical CT and MRI with fast sequences, and ultrasound and Doppler. And it was the first days, of course, of CR and DR in radiography. DSA had already been around for 10 years or so. And I decided to go into then diagnostic medical physics. And it's what I love to do. I work under Dr. Larry Fitzgerald and graduated with a PhD from the University of Florida, as I said. I went then on to my first job in Pittsburgh, Pennsylvania, and I had the opportunity and the privilege to work with Dr. Harvey Neiman, who's now the actual executive director of the American College of Radiology, has been for many years. And he was the chairman of the radiology department at the Western Pennsylvania Hospital, which is where we worked. And within 3 months of joining the medical physics staff there, he appointed me as chief of radiation physics and radiation oncology, which is one of the most interesting things in my career, because by appointing me like that, a diagnostic physicist was put as the supervisor and immediate boss of a bunch of radiation therapy physicists. So I was there for 5 years, and Dr. Neiman is the one that I consider my true mentor. He was the one who allowed me to make lots of mistakes and showed me what is it that I need to do, and the things that I should do and the things that I shouldn't do. Gave me my start in the administrative part of the work. And then at some point in time, in the early 2000s, the position of chief of diagnostic physicist at the University of Florida opened up. And of course, I thought I had no chance, so just for the sake of it, I sent my application, and before I knew, I was back in Gainesville, and where I have taken the division of diagnostic imaging physics to be 1.5 FTE full-time physicists and 1.5 FTEs of graduate assistants to what it is now, which is 4 FTE PhDs in diagnostic physics, all of them certified by the American Board of Radiology, and with 7 or more years of experience, everyone. And 3 diagnostic residents. We started the diagnostic resident program about a year ago. And a large group of graduate students and graduate assistants performing research that is unique in the field of diagnostic imaging and dosimetry in diagnostic imaging. I came about RTU as a result of my better half joining RTU as a student a few months ago, and now I am here developing the diagnostic track for the graduate medical physics program, and developing the diagnostic residency, and trying to help RTU grow in the way that it needs to grow. So that's, to put it in a short way, what I have done professionally. Thank you.